Is that you live streaming, Crystal?
Yes, ma'am. Did you get
Okay.
a notification?
Yeah.
Okay. Like, what is happening?
Is that you live streaming, Crystal?
Yes, that's me.
That's
Can you
so weird.
hear
I
me?
heard
Ma'am?
myself.
You got
Okay.
a notification.
Yeah. There's
Like,
an echo.
what's happening?
Is that you live streaming, Crystal?
Yes, that's me. Okay, I think I've now gotten rid of the echo, got the right slides up, and have the live stream going.
All
All right.
right.
All right, so as soon as everybody's ready, I will start letting people in from the waiting room. All right, now we'll go ahead and let people in from the waiting room. Thanks everyone for your patience. Well, hello and welcome. As we let people trickle in from the waiting room, or if you're watching us live on YouTube, thanks for joining us. If you're watching this recording, we're thankful that you're here to receive some really fantastic education today. We'll keep watching the Zoom waiting room and letting people in as we go, but in the sake of time, we'll go ahead and get started today. So welcome everyone to our Mom Congress Town Hall. Today is Thursday, November 16th. And we're very excited to have you all with us. My name is Crystal McCauley, and I'm proud to be the Community Director for Mom Congress. Our program today is going to start, as usual, with an opportunity to chat. So please let us know where you're visiting from, your name, your location. Are you a Mom Congress member? Are you a visitor? We're excited that you're here either way. We've had almost 40 new members join us in the last 3 weeks. So you may be among some of our newest members, or you may just be here dipping your toe into the work that Mom Congress does. And either way, we're excited that you're here. So say hello in the chat. We're going to get started today with our town hall agenda. So we'll start with a member spotlight of 2 of our current Mom Congress members to inspire you with their work and passion. We'll go into some amazing speaker presentations and opportunities for education, followed by a guided panel discussion led by our director, Dr. Ebony Wren. And then we'll give an insight to our upcoming events and closing. We intend to spend about an hour together here today and do welcome you to put questions in the chat as we go. Ebony will give some more insight to how we'll manage the chat, but know that we are watching and filtering for questions as we go live on Zoom. So at this time, I would like to welcome Becky Harmon and Zay Bell to turn on their cameras, and I will add spotlights to you both. Thank you for being here today. And I'm going to take just a quick moment to read both of your bios. So Becky Harmon joins us from Los Angeles, California. She's a program coordinator for training with the Preeclampsia Foundation's Mama's Voices program. She's passionate about improving birth outcomes for current and future mothers. She works to produce and implement an in-person and virtual training program with patient family partners and providers through Mama's Voices. Becky is a 3-time miscarriage survivor, as well as having experienced post-traumatic stress disorder, postpartum anxiety, as well as postpartum depression. Becky shares her story to educate providers and legislators to destigmatize getting mental health treatment, including therapy, medication, or direct treatment, and to elicit change for mothers and their families affected by postpartum mental health challenges. Thanks for being here, Becky. And Zay Bell's deep passion for Black maternal health and Black infant mortality was birthed out of the heartbreaking loss of her son, Xander, who passed away at just under 22 weeks gestation. She now is the executive director of Zeal of Xander Incorporated. She has dedicated herself to making a difference in this critical area. Her commitment to addressing the issue of Black infant mortality led her to create The Morning After, a Black infant mortality anthology. It's the first dual anthology that brings Black providers and Black mothers in loss together in one body of work. In addition to her work with Zeal of Xander, Zay is also the visionary behind the Black Birth Institute Incorporated, a nonprofit organization based in Florida that focuses on creating customized Black maternal health initiatives for municipalities by creating town halls that allow stakeholders to collaborate and strategize on appropriate actionable steps to combat unfavorable outcomes for Black infants and Black birthing people within their own cities and townships. So thank you very much, Zay, for being here as well. And thank you both for your dedication to moms and families. I've seen it in action, and I know the passion that you both bring is really awesome. So want to take the opportunity today to just ask you both how Mom Congress was so lucky to find you. So, Becky, if you want to kick us off, tell us how you learned about Mom Congress and, what inspired you to become a member.
Sure, yes. So after the birth of my son and having postpartum anxiety and depression, I found Postpartum Support International, and I became certified in the perinatal mental health in the field. So then from there, I found the Policy Center for Maternal Mental Health, which was formerly 2020 Mom, and I found their ambassador program. So through the ambassador program, I actually found Mom Congress, and I became a member in 2020.
Thank you so much. That's one of the great pathways for Mom Congress, is having fantastic partnerships. So glad to hear that your work led you to be with us here today. And Zay, how did you learn about Mom Congress?
Mine isn't exciting as Becky. I was on perusing through the pages of social media. I was on Facebook, and I saw a advertisement for Mom Congress, and it kind of piqued my interest because my good, dear, sweet friend Tamika Isaac is a part of Mom Congress. Tamika and I say that Xander and Jace are best friends in heaven, and so that kind of it makes us feel better to know that they're together and they're enjoying a great time. So when I saw the advertisement and that the group was going to be in DC, I knew that there was a place that I needed to be, and this was an organization that I needed to be a member of. So I immediately joined Mom Congress as soon as I saw the advertisement, and the rest has been beautiful history.
We're so grateful to Tamika. Tamika is one of the great ambassadors of Mom Congress, and we're so lucky that she knew you and could bring you into the fold. So thanks for being here. Well, Zay, so you came to DC for the first time this year for our Hill Day. Will you tell us a little bit about what that was like, either before or being there, or anything you want to highlight about coming for Hill Day?
I think Hill Day was really an eye opener, right? For me, just getting into the space and how everything worked out just beautifully. So being able to navigate the space of having face-to-face conversations with our representatives, with Senate, and also being undergirded with the support of the bills, Mom's Agenda, being educated on what that looks like. I've been in this space for quite some time. I'm a facilitator, so I had gotten my Xander story down to a perfect science, and so being able to sit amongst individuals that have been doing this for quite some time gave me the flexibility and I would just say the courage to tweak how I presented so that it could be understood at the legislative level, because they're not emotional people, right? They are very, some are very black and white, but what I learned was a beautiful cocktail of being emotional, being the human part of the statistic um, that they see on those papers and in CDC and in the news and all of those things. I wanted to really put a face with a name, and Mom Congress allowed me to be able to do that.
You did a really beautiful job. So thank you for the way you described it. Becky, you've been to DC with us a couple of times. You want to give us any reflections on what it's like to come to DC Hill Day? And I think you've taken meetings virtually and in person over the years.
Yes. Yes, so I've gotten to kind of experience it both ways, and also shout out to Tamika for me, because I didn't know anyone my first year, and I texted her and I was like, Tamika, are you going to Mom Congress? And she's like, yeah. I was like, okay, I'm thinking of going. And she's like, I've got you. So she's a good advocate for Mom Congress, and she helped me get over the fear, because I didn't know anyone else really that was there. But anyways, yeah, so before going to my first Mom Congress, I did the Mama's Voices Patient Family Partner certification. And that really helped train me in how to tell my story in a productive way, and just to make sure that I was ready, because I was very intimidated by talking to legislators at first, even virtually. So there were more seasoned members that made me feel at ease, and were able to just guide me and kind of, calm my fears and explain to me really how it went. And this year in person was really exciting. It was very fast paced, but I really did love meeting with my Congress members, staff, and I even got to go into the secret underground train in the tunnels and just kind of get to see that secret part of DC. And it was really cool to see the congressional heavy lifters of the bills in our Mom Congress reception after our Hill Day. And it just felt nice to have the support from the legislators in these bills that support moms and families.
Yeah, thanks so much, Becky. I always use your example of inviting your legislator, letting her know that we were going to have our reception. And sure enough, she came right by. That was really fantastic of Representative Chu. So, all right. Well, the last question I have is for Zay, because Zay has been doing some really incredible recruitment of new Mom Congress members. So if you're among the 40 that have joined in the last couple of weeks, there's quite a few of you who came by way of Zay spreading the word. So I just wondered if you would share with us some of why you share the love and how you inspire other people to join you. And we have a discount code to share in the chat again today, if anyone wants to join us that's not already a member on the call.
So initially, when I was there, I went to have a meeting with my House representative, and I was sharing with them about the yellow crayon story that I had Googled. And the interesting thing about that is when I Googled the story behind the yellow crayon, one of the examples used Buffy the Vampire Slayer. And that example included a character named Xander. And kind of encouraging that person to continue with the good work, right? And so I think that entire couple days that I was there was to continue with the good work. And so the good work looked like looking at our map and seeing what states were not represented. I'm a strategist and I'm solution based. And so when I saw the states that were not represented, I came back and said, hey, can you guys just give me a whole lot of packets and let me just run around? And so I ran around and I was able to really introduce Mom Congress to a lot of individuals that really didn't know why we were there and what we were doing. And then I recognized that there should never be an office on the Hill that does not know Mom Congress. How can we fix this? And the only way that we can fix it is with bodies, right? And so I have really made it my personal goal to get at least 20 people to join. I think I'm up to 13 now. So I contact you guys every week, like how many more do I need? And so I am diligent about that, because I am a firm believer that when women gather, things happen. And so putting a lot of women that are intentional and that are purposeful in one place A shift has to happen. Change has to happen. The things that we are, trying to get accomplished has to manifest when women gather and they get together. So it is my personal goal to ensure that women are gathering, specifically in the states that we do not have represented, to assist us in advocating. They always ask me, why did you get into the maternal health space? And the reason that I got in the maternal health space is that there is no way that they could have thought that my son would die and I not do anything about it. And so this is my something that I do about it.
We're so thankful that you're here today, and thank you, Becky, for your time. And thinking of Xander and Jace together makes my heart very happy. So thank you for all that you bring to the community, and for being here today. And Ebony, we will turn it back over to you.
Awesome. And I just received the chat while we're transitioning. I did see it, Kelly, and I just want to echo and uplift it. She asked, how do I share more about Mom Congress to people who I work with? So we will definitely follow up with everyone after this and share how you can share the word. So thank you both. All right. So I just want to set the tone. We're happy that you've joined us today. Our goal is just to provide information, knowledge, and share resources to you all on the topic of vaccines. We are not here to push an agenda. Our goal is just to educate and provide information, which is what our members and advocates have asked for. We know that we're in the midst of COVID, flu, RSV, ABCD with these kids being out of school. So we just want to provide the information for everyone. And so I have the pleasure of welcoming our speakers today, who will be sharing more about their backgrounds and information with all of us, followed by our panel discussion and a Q&A. So Beth is the Chief Executive Officer of Healthy Women. Beth brings a unique combination of sharp business expertise and women's health insight to her leadership of the organization. She has worked in the healthcare industry for more than 25 years, helping to define and drive public education programs on a broad range of women's health issues. Beth launched and has expanded the Healthy Women brand, and as a result of her leadership, Healthy Women was recognized as one of the top 100 women's health websites by Oprah Magazine and by Forbes for 3 consecutive years. Healthy Women now connects to millions of women across the country through its wide program distribution and innovative use of technology. She is also a practicing nurse in maternal child health at Riverview Medical Center in Red Bank, New Jersey. In addition to her nursing degree, Beth holds degrees in political science, business, and public administration from Marymount University. Beth is also an amazing partner of Mom Congress. I had to add that into her bio introduction, and we just appreciate all of the support that Beth has given Mom Congress over the years. And I'm going to turn it over to you, Beth.
Thank you so much, Ebony. And I'm so pleased to be with all of you today. And what I'm going to do is share a snapshot of a survey that we've recently done to really level set on where we are with pregnancy and vaccinations. So let me kick off with where we are right now. So the U.S. Centers of Disease Control and Prevention, the CDC, recommends that pregnant people get seasonal flu, Tdap, and COVID-19 vaccines to help protect themselves and their babies. However, despite the public health recommendations and the widespread evidence supporting the safety and effectiveness of maternal vaccines, there continues to be suboptimal levels of vaccinations among pregnant people. Immunizations rates overall declined since the start of the COVID-19 pandemic. However, recent data from the CDC showed declining rates of immunization among pregnant people specifically, which is why we wanted to understand why. Why is it so? Why is the immunization among pregnant people declining? So we did a survey to understand the current perceptions towards vaccines held by pregnant and postpartum people and the providers who recommend the vaccinations. The results of our survey aim to deepen the knowledge around the attitudes and the barriers towards vaccines during pregnancy and help inform that next step for public health experts, for policymakers, and other stakeholders involved in the maternal immunization space. So some of our key insights from patients, and when I say patients, I mean pregnant people, new moms who have given birth in the last year, and healthcare providers, obstetric and OBGYNs, family and general practitioners, pediatric and maternal fetal medicine docs, and reproductive and endocrinology physicians. So what we found is the access to prenatal care. Most pregnant people reported receiving the flu and Tdap vaccine compared to the COVID-19 vaccines. And a slightly higher proportion of people who are currently pregnant reported having received or are planning to receive the flu and Tdap vaccine in comparison to reporting that they've already received or plan to receive the COVID vaccine. So they're planning on the flu and the Tdap, not so much on the COVID vaccine. Racial and geographic disparities exist when it comes to assessing maternal care for pregnant people. Although pregnant people and new moms reported that they are satisfied with the prenatal care that they received during their pregnancy, and that it was very easy to access prenatal care, experience varied by racial groups. Only 46% of Hispanic and 51% of Black respondents reported having easy access to prenatal care when compared to 67% of non-Hispanic white respondents. The largest disparity is among the 18% of respondents who identified as living in rural areas, who had received a COVID-19 vaccine during pregnancy compared to 42% in the urban and suburban areas. Rural areas show lower flu vaccination rates, 25% in rural areas versus the 49% in urban areas. And there was no stats that were significantly disparity exist for the Tdap vaccines. And then the patient's attitudes towards maternal vaccinations. Pregnant people and new moms understand the benefits of getting vaccinated, such as the role that vaccines can play in protecting both mother and baby. For example, a majority, 8 out of 10, say that vaccines help protect the mother and baby from serious and potential dangerous diseases. However, safety and the side effects of the vaccines are constantly cited as the most common concern and perceived barrier to immunizations by pregnant people. And who's the trusted source for information for patients? While the CDC recommendation is considered a credible source of information, pregnant people want to know more about the safety of vaccines from the providers that they rely on for their care. They rely on their healthcare provider for the recommendations to take vaccines. Providers are still the most important voice. And from the healthcare provider side, what did we learn from the survey? Well, the providers' perceptions of vaccines, most providers who participated in our survey routinely recommend the flu, Tdap, and COVID-19 vaccines for their pregnant patients. What were the barriers to providing care? What we found out is the top barrier to not administering COVID-19 vaccines are stocking and inventory management. Almost all the providers that responded to our survey said that stocking and they stocked and administered the flu and the Tdap vaccines, while significantly fewer providers administered the COVID-19 vaccine, citing that stocking and the inventory management as the top reason for not doing so. Also, the financial and administrative burden also provided a barrier for providers who did not accept publicly funded insurance plans such as Medicaid. And sources of information for providers. Providers needed more resources and information to make recommendations about vaccine during pregnancy. So it's all about the education. Providers said that while they rely on public health agencies and their medical associations to gather information and guidance on vaccine recommendations, close to 4 in 10 said that they needed additional information to make recommendations about vaccines during pregnancy. And barriers to state immunization systems. Nearly 40% of the providers reported facing some interoperability challenges and issues for entering and sharing data across various data platforms. So to do a quick recap, what is needed for better vaccine uptake? Well, we need to continue educating patients, healthcare providers, and pharmacists. We need better education materials. We need to understand what type of education materials are needed and working for both patients and healthcare providers, and various ways to distribute information and resources on vaccines and vaccine safety. We need to address all the barriers to vaccinations found in the survey: maternal knowledge, geographic, social influences, contacts, recommendations by healthcare professionals, risk benefits, and accessibility. With changes to public coverage for vaccines that kicked in on October 1st, we need to understand what coverage issues exist for vaccines, particularly for new RSV vaccines. And as we head into the respiratory disease season, I'm hearing a lot of questions from my patients. Am I at risk? Should I get vaccinated? And my answer is always yes. It is very rare to see a fully vaccinated COVID patient critically ill in the ICU. And now I'll turn it back to you, Ebony.
Thank you so much, Beth, for sharing this very, very important information. I think it's really valuable to hear the results of the study and to hear, the perceptions, the barriers, the suggestions, and all those things. So thank you for sharing. All right, moving along. I am going to read the bios really quickly for the rest of our speakers, and then I am going to pass it back over to the CDC. Dr. Lakshmi is a board-certified pediatrician at Centers for Disease Control and Prevention in Atlanta, Georgia. Dr. Lakshmi is currently the co-lead of the COVID-19 Vaccine Advisory Committee on Immunization Practices Work Group, which makes vaccine recommendations of the United States. She is trained in pediatrics, infectious diseases, and vaccinology, and has a background in the safety of vaccines given during pregnancy. Dr. Lakshmi is also the proud mom of 2 girls. Dr. Catherine leads the Vaccine Effectiveness and Policy Team in the Coronavirus and Other Respiratory Viruses Division in the National Center for Immunization and Respiratory Diseases at the U.S. Center for Disease Control and Prevention. She co-leads the Maternal Pediatric Respiratory since RSV, I'm just going to say RSV work group for the Advisory Committee of Immunization Practices Work Group. She is a pediatrician and also the mother of 3 children. Joining us as a panelist, we also have Dr. Rogers. Dr. Rogers is a board certified and fellowship trained in maternal fetal medicine and why am I stumbling over my words today?
You got it.
OB-GYN. I'm just going to say that. How about that? A native to Chicago, Illinois, she now resides in the Rockford area, where she has held the role of Division Director for Maternal Fetal Medicine and the Co-Director for the Administrative Perinatal Center for the Northwest Illinois Perinatal Center for the last 10 years. She is a fellow of the American College of OB-GYN, board certified and maternal fetal medicine. She is also a member of several professional organizations, including the Society for Maternal Fetal Medicine and American Institute of Ultrasound and Medicine and the American College of Obstetricians and Gynecologists. She has served on committees and boards for the state of Illinois, advocating for improved standards of care and promoting awareness of women's health issues, including being involved in policy development, working with local agencies and healthcare organizations to implement initiatives aimed at reducing health disparities of maternal morbidity and mortality. Most recently, she served on the Severe Maternal Mortality Subcommittee for Illinois Department of Public Health, which examined cases around the state in effort to identify barriers and improve the quality of care in pregnancy for everyone. Dr. Rogers' goal is to provide compassionate and evidence-based care to women during pregnancy and childbirth. She strives to improve outcomes for both mothers and babies and to promote equity in childcare. So you all have amazing speakers today, in short. I know I just read all of their bios, and I am happy to pass it over to the CDC.
Can everyone see my screen?
Yes.
Okay, perfect.
Yes, thank you.
All right, so good afternoon. My name is Lakshmi Paniatkopoulos, and I work at the CDC in the Coronavirus and Other Respiratory Viruses Division. Today, I'll present a brief overview of the recommendations for COVID-19 and RSV immunizations for pregnant people, infants, and children. So we have reached a point now where we have very effective tools to prevent respiratory viruses, specifically those impacting pregnant people and their infants. This is the first fall and winter virus season where there are immunizations available for COVID-19, RSV, and flu. COVID-19 can cause severe illness in pregnant people, infants, and children. COVID-19 during pregnancy is associated with severe maternal outcomes and adverse pregnancy outcomes. In infants who are less than 6 months of age, who are also ineligible for COVID-19 vaccine themselves, hospitalization rates are similar to those in adults ages 65 to 74. And despite a lower burden among children aged 17 years or less relative to the other age groups, hundreds of deaths occurred in this age group in 2021 and 2022, half of which were in children with no underlying conditions. For COVID-19 vaccines, the updated 2023-2024 formula is a monovalent vaccine based on the XBB lineage of the Omicron variant. This updated COVID-19 vaccine is recommended for everyone ages 6 months and older. CDC recommends staying up to date with COVID-19 vaccines. For everyone ages 5 years and older, they should get 1 dose of the updated vaccine to protect against serious illness from COVID-19. For children ages 6 months to 4 years old, they need multiple doses of COVID-19 vaccines to be considered up to date, including at least 1 dose of the updated COVID-19 vaccine. And people who are moderately or severely immunocompromised may get additional doses of the updated vaccine. As far as pregnancy, everyone who is pregnant, trying to become pregnant, may become pregnant, and who are breastfeeding should stay up to date with their COVID-19 vaccine and get the updated 2023-2024 vaccine. I'd also like to emphasize here that COVID-19 vaccines have undergone and continue to undergo the most intense vaccine safety monitoring in US history, and this includes for pregnant people. So now I'll shift and talk about RSV. RSV infection is the leading cause of hospitalization in US infants. Most infants are infected in the first year of life, and nearly all are by age 2 years. 2 to 3% of young infants will be hospitalized for RSV. RSV is a common cause of lower respiratory tract infection in infants, and the highest hospitalization rates occur in the first months of life. And all young infants are at risk for severe disease with RSV. Out of 79% of children hospitalized with RSV who are aged less than 2 years old, 79% of children hospitalized with RSV who were less than 2 years old had no underlying medical conditions. We have two new tools to protect babies from severe RSV illness. First, the maternal RSV vaccine is recommended for pregnant people during 32 through 36 weeks gestation with seasonal administration in order to prevent RSV in infants. In most of the continental US, seasonal administration is September through January. In Alaska and jurisdictions with tropical climates, including Hawaii, Southern Florida, and US territories, providers should follow the local guidance on the timing of administration. The second tool is nirsevimab, which is a long-acting monoclonal antibody for RSV prevention in infants. Infants who are less than 8 months old, who are born during or are entering their first RSV season, are recommended to receive 1 dose of nirsevimab. Children who are 8 to 19 months old who are at increased risk of severe RSV disease who are entering their second season are also recommended to receive 1 dose of nirsevimab. All infants should be protected against severe RSV illness. Either the maternal RSV vaccine or nirsevimab should be used, but most infants will not need both. If you are pregnant, talk to your healthcare provider about which option is best for you and your baby to ensure they're protected against severe RSV illness. And finally, I'd like to mention a CDC Health Advisory, or HAN, that was published on October 23rd regarding the limited availability of nirsevimab during the 2023-2024 RSV season. The takeaways from this HAN are as follows. The supply of nirsevimab is insufficient to protect all eligible infants weighing greater than or equal to 5 kilograms during the current season. In addition, the supply of the 50 milligram dose for infants weighing less than 5 kilograms may also be limited. The CDC interim recommendations provide options for clinicians to protect infants from RSV in the context of the limited supply. The focus of these interim recommendations is to prioritize the infants who are at highest risk of severe RSV disease, who are the youngest infants and those with underlying conditions. And also focuses on encouraging receipt of the maternal RSV vaccine during 32 through 36 weeks gestation. Thank you so much for your attention.
Thank you so much, Dr. Lakshmi, Dr. Lakshmi, for sharing all of that important information with our attendees today. I would like to start and kick off the panel discussion with all of our amazing speakers. I see Crystal is transitioning us over. Thank you, Crystal. And I'll kick us off with my first question. So Mom Congress has an annual package of supported legislation that we call the Mom's Agenda. It's totally fine if you don't know every piece of legislation in our Mom's Agenda, but essentially each piece of legislation is bipartisan at introduction and it aligns to our policy priorities. Maternal health, maternal mental health, working families, paid family leave, and childcare, with a focus on equity. From your perspective, and each of you all bring such diverse perspectives, from your perspectives, how does vaccine education and awareness impact maternal health, maternal mental health, and working families? Why is it important for us to be knowledgeable about this? And anyone can respond.
So good afternoon. I'll take a stab at that. This is definitely a multifaceted answer. So I don't think that there is one answer that would be the most correct. I'd say that education and being able to distribute proper education is very valuable. And I think that if you're not clear on that, you just look at kind of where we've been over the last 2 to 3 years. Disinformation is actually worse than not having access to the correct information. It's one of those things where just like when you think about it take a step back from vaccinations. When we as people and moms and everybody, we talk about things, people tend to remember the negative stuff, right? It's always harder to recall the positives, but it's very easy to not only recall negatives, but distribute negatives. And as that gets distributed in a form or a platform that's not accurate, everybody starts to add in a little bit more. So by the time that story actually gets distributed to the patient side, it is so, it just paints us in a light that, number one, is not positive, is not accurate, and then it places us in a position of being adversarial. I think that we absolutely need education to assist with being transparent in terms of what we're talking about, what's important, what really will help, and what will combat disinformation. The other part of this, of course, is as informatics grows, it becomes important for the information platforms that are accurate have to also grow at the same rate, if not faster, in order to really be able to reach people where they are. A lot of my patients actually, although they listen to providers, a lot of them will come in with quoting something that they dug out of the internet, and sometimes the places that you can go on the internet, and the things that you can actually see and read are breathtaking. You would be, at least I was surprised. I always ask my patients, where did you get it from? And then I do a search and go back to see what they're actually reading and where they're getting it from. A lot of the platforms that they actually see look just like reputable sources, the way that they are built out. But as you dig a little bit deeper and get beyond the surface, you see that it's not reputable, and you can tell from the way that it's written. But I just say that as to say, but it's there. I apologize. I'm sorry. I'm on call as well. But that information is there. And so we need to have good information, accurate information, reputable information that's available for our patients to read at a level that they can understand it. We need to have the same type of education for physicians and providers so that they can understand it and they can also support it, as well as we need that same type of information written in a way that administrations can also read it, because they are helping us in terms of reducing those barriers of access. So we cannot have enough education surrounding information that's accurate in order to combat disinformation. There's no other way around it.
Yeah, and I'm just I'll jump in on Dr. Rogers' comments too, because I 100% agree. And the biggest thing from the survey is the need for education, right? So from both patients and healthcare providers, we heard from both groups that there was a need for education, and one size does not fit all. So when we think about rural, educating people that are living in rural communities, understanding what's working in those communities and creating educational tools that will work in those communities. The same with urban and suburban areas are going to be completely different. So really understanding the patient populations that we're trying to reach and working with groups that are working with people in those areas and creating educational tools and resources that will work in those communities is so important.
Thank you both. Does anyone else have anything else to add to that question?
I'm happy to chime in because I think as being part of a working family, I do think that vaccine education is important. Vaccines are a huge public health success, and as a result, we aren't seeing a lot of the infections that vaccines are preventing. And so that really kind of makes it hard to grasp sometimes why vaccines are so important, because we aren't seeing these illnesses as much anymore. And I do think that education is important about the vaccine preventable diseases, about the importance of vaccines, and that this really does have an impact on working families, because you think about COVID vaccine and how if you get a COVID infection or your child gets a COVID infection, the time lost from school, the time lost from work, you might not necessarily be able to take that time off. Thinking about health equity and how it might be harder for some people to have these kind of accommodations with their specific jobs. And so I do think that education on vaccination is important, thinking about working families.
Thank you so much. My next and final question before we kind of head into a Q&A is centered on basically like using your voice. And so one thing that I always encourage our members, advocates, is to use their voice at Mom Congress. And so in using our voices, what are some of the questions if someone is concerned about vaccines for themselves or for their child? I believe in asking questions, but I think it's important sometimes to ask the right questions in a sense. And so what are some of those quote unquote right questions that we should consider when having the conversation about vaccinations?
So I can start with that. I mean, I think it's, it's always important for every, any patient, with any healthcare intervention, including vaccines, to make sure that they understand what they're getting and how that can affect them. I think, the right questions are to ask, to really to ask what's concerning you. We heard already that safety concerns about side effects and safety are a barrier to vaccination. And as Dr. Lakshmi already, talked about, COVID-19 vaccines have undergone the most intensive vaccine safety surveillance program in U.S. history. These vaccines have a very good track record. They're very safe, and so I think asking those questions, getting reassurance from a trusted healthcare provider is very, important, and we should be, to the last question, empowering our healthcare providers to have those data and being able, to have those conversations with their patients. And then also, how is this going to benefit me and my child? We know that, COVID-19 vaccines, you provide sustained protection against severe COVID-19. We know that RSV vaccines during pregnancy can protect the infant after birth. We know that flu vaccine protects mom and baby and protects, everyone who's recommended for them. So to me, those are the right questions. And these are the conversations we want to be having, as a provider, as a pediatrician, these are the conversations I want to be having with the families I'm taking care of.
And I'll also add on to what Dr. Catherine just said. I think I just like to emphasize that the question that is most important to you, or the concerns that are most important to you, don't be afraid about speaking up, because your provider should have the information or be able to track down the information if they don't specifically have that information. And it will make that conversation a lot more productive. And then second, I would also just like to say that it's okay to ask, would you get this vaccine? Did you give your children this vaccine? Because I don't mind that at all. I'm happy to tell you that my children did get COVID-19 vaccines, and I did get vaccines during pregnancy. And, anything that can help make you feel more comfortable is something that, as a pediatrician and as a provider, I'm happy to share.
I think I completely agree. I don't think that there is a right question. The right question is the question that you have, right? And so no matter how that comes out, it is what it is in terms of what it is that you want to know. I think that if it is, hey, can you just tell me more about the vaccine? Or I'm concerned about whether or not I should be getting the vaccine. So I think those are all great places to start. I would just say that I think the other part is that hopefully your providers are also asking you, like, what have you heard? Because that is usually most of the times when patients are brave enough, which I always respect, to bring up something that we haven't talked about, it's because they've heard something or they saw something that's concerning them. So, and they may not bring that part up. So I think it's always incumbent upon us as healthcare providers, is when we do have them in our space, is to ask, what have you heard? Because that may absolutely help trying to tailor down the question that they really have and making sure that you get an opportunity to at least address or provide another opinion or provide a resource for that patient to look at when they're not there, right? So I think that those are things that we can both do. It's not, I never like to think healthcare should be weighted on the patient. It's really incumbent upon all of us to have a collaborative relationship so that I know what it is that you need, and then I can make sure that I'm providing that or provide you with a resource to do it. So it's absolutely, if that's the one thing that I can impress upon everybody, it's a two-way street. Healthcare is not unilateral. It's two ways, right? It's reciprocal. So we have to, be comfortable working together to work through what it is that you're concerned about. And healthcare providers, if we don't have an answer, making sure that we get that answer for them, right? Or direct them to where we think that answer is the most appropriate place to look at. But I say in terms of, dealing with that, whether or not your question will come out correctly or whether or not, you're saying the right thing, I think it's very easy just to open-endedly say, hey, just tell me more about X, Y, and Z.
Thank you to everyone. This was so dynamic. I appreciate all of you all for joining us today. I do want to open it up to our audience and registrants today. I see some amazing comments coming in the chat. Looks like people are echoing our dynamic speakers. But to our attendees today, if you have questions that you'd like to ask, and I will be filtering through these, so I can't promise that I'll get to everyone, but I'll try my best as I look at them. Can you drop them in the chat for us? We're going to ask that you don't come off mute today, but please drop them in the chat for us as you have these dynamic speakers at your fingertips right now. And I will check the chat to see. Don't be afraid to ask, as Dr. Rogers just said. So if you have a question, now is the time to ask, and it's okay. And it sounds like what I'm hearing is like, be vulnerable in asking the questions as well. So
I would say as a nurse, it's like, I welcome all questions, and I want that conversation with patients, and I want them to, it's a two-way street, and sometimes you only have 7 to 11 minutes with your patients. So, use that time as effectively as you can. So come in with your list of questions. I'll have questions, and it's a great opportunity to do some education and making sure that that patient has what she needs by the time she's leaving my office.
I agree, Beth. And full transparency, I had a telehealth appointment yesterday with my daughter's pediatric nephrologist, and we're talking about potentially her having to do rituximab. And she said, hey, if you choose this, you can't get a live vaccine a month before or a month after. And so I started diving into my questions about that. So I agree. All the questions.
Hey, Ebony, this is Crystal. And I just had a question come in via text message. I think there's another one in the chat, but right on point with what you just said was, people are asking, is there any recommendation as far as delaying other infant vaccines when you're considering, getting your infant vaccinated for seasonal, COVID, RSV, things of that nature alongside their regular immunizations?
I can answer.
Thank
Yeah,
you.
I can answer that. Infants should get all their recommended vaccines on time, on schedule. For the COVID-19 vaccine, for influenza vaccines, those both start, the eligibility starts at age 6 months and up. So everyone ages 6 months and older recommended to receive an updated COVID-19 vaccine as well and an influenza vaccine. Those can be administered on the same day as other recommended vaccines. So if the child is in for an appointment and they need another vaccine on that day, they can all be given together. Nirsevimab, which is the infant immunization for RSV, also can be given on the same day as other recommended vaccines. That eligibility is a little bit younger, so it's in the younger babies for the most part. But again, all eligible vaccines, they can get all recommended vaccines on the same day. And should, because that's really what helps get those kids the protection is, as soon as possible. And if anybody has the question about pregnancy, I'll add the same is true during pregnancy, that you can get all these recommended vaccines at the same time.
Speaking of pregnancy, we did have a question come through. It says, is after the first trimester the best time to get vaccinated?
So I'll take that vaccine by vaccine, if that's all right. So for COVID and influenza vaccines, the best time to get vaccinated is as soon as you're eligible. Both of those vaccines protect both the mom during pregnancy as well as the infant after birth. And so what we really want to do is get pregnant people protected as soon as they can, so they can be given at any time during pregnancy or before pregnancy. For RSV vaccine, it is specifically indicated to be given during 32 through 36 weeks gestation. So that's later in the third trimester. And the reason for that is because that vaccine is really intended to protect the infant after birth. And so that vaccination window is later for that particular vaccine. And then, I'm happy to answer other questions or have our other panel members ask about other particular vaccines, but for COVID and flu, again, any trimester, as soon as they're eligible. For RSV, it's later to protect that infant.
So let me just jump in here really quickly. So those are the correct schedules for pregnancy. But again, it's always one of those things. There's a question and then there's the underlying question. So in particular, the participant asked about the first trimester. So let me just take a second to say why I think that the first trimester issue may come up. So first trimester is, of course, everybody's paging me during one right now. It's so weird. I apologize for that. But first trimester is a time period where you will have sometimes patients and some providers might even also kind of fall into this category where they're very hesitant to do anything in the first trimester. And it's not because it's a problem with what it is that we're talking about in terms of vaccines. The problem with is just first trimester inherently, right? No matter what you do, first trimester is probably the more risky trimester for miscarriage, independent of anything else. So what tends to happen is that a lot of data gets mixed with the first trimester, saying that, okay, first trimester is a higher risk if you do X, Y, and Z for miscarriage. But in reality, that is your baseline risk anyway. So a lot of the data gets messy when it talks about the first trimester. But I completely agree with Dr. Catherine. It is safe in the first trimester. There's nothing that you're going to, none of these vaccines that we're talking about today will change that baseline risk that you have anyway in the first trimester. That it does, they're mutually exclusive. But that is usually what kind of comes up when people talk about the first trimester. It's because pregnancy by itself, no matter what you do, everybody will have this higher risk of miscarriage in the first trimester period.
Awesome. Thank you both. And I think there was just one more question. Okay. Why is so much pressure placed on a pregnant mother? Why are they expected to know if I don't even know the question to ask, or if I don't know something? Okay, I think, and Ali, correct me if I'm wrong, but is the question like, why is there so much pressure placed on a pregnant mother to know so much about the vaccine? Are you asking like, why isn't there like proactive information shared with the mother? Correct me if I'm wrong. I just want to make sure that I'm asking your question correctly. If you're able to, even if you'd like to, if you're in a place to come off mute, that will be fine as we wrap up.
So Ebony, I can jump in. We have great information on vaccines and vaccine scheduling at healthywomen.org. So
Okay.
Mom, that mom to be, and for that new mom, we've got great resources that she can use to help inform her and help with any question, teen up questions that she can ask her healthcare provider.
Sounds good. Thank you, Beth. Dr. Rogers, from a provider perspective, like when you're seeing patients and whatnot, is that something that's like openly given to patients up front? Like, hey, here's some information on X, Y, and Z vaccine, or is it, what has your experience been with that dynamic?
So I think it is Allie that asked the question. So in terms of information in pregnancy, you get a lot. You do, right? It's an exciting time. It's a unique time, right? It's a time when, like I love pregnancy, if you can tell, but it is a time where there are just a lot of things happening. And so it's not the same thing as just take care of, we used to think as just a regular adult, right? No, it's actually not. It's very different. The obstetric population is very different in terms of what your concerns are and in terms of what we need to do. So I would say, first of all, you think about it in terms of time. If you have a primary care doctor, that's somebody you're going to see from dusk to dawn, right? So that's somebody who has an opportunity to impact you, to give you information throughout the course of your life. If you have a pediatrician, right, from the time you're born to the time you're 18, you have a long amount of time to actually impact and give information in a formal relationship. So it may not seem as difficult, but for us, from being from the obstetric population, we have 10 months. That is it. Right? We're lucky if we get 10 months because it depends on when you initially present. So there is a challenge for us to do a huge amount of work, education, treatment. Everything has to happen within this short period of time so that we can give you the optimal delivery, right? So it's a short period of time. So we don't have as much time to, we have to talk about a lot of things. So that's one. So it could definitely feel overwhelming, and it feels like a lot of it, but it's because it's such a short time constraint. It's not as long as it may feel. People talk about feeling pregnant forever, but the reality is it's such a short period of time. So that's one thing. The other thing is, I think that this really brings up the importance of being able to have a good relationship with a provider that you trust. It's so important because all of the burden is actually not on you as the patient. Really, the information that they're providing you are just kind of snippets or tidbits for you to decide, like, what thing you think is more important for you want to talk about or is important for you in your healthcare. I can assure you, some people want to talk about vaccines. Some people don't want to talk about vaccines. They want to talk about, losing their water or delivery planning. So everybody's across the board. I think that the problem comes in is that if you don't have somebody you trust that can take that burden on for you, then it does become difficult. But your healthcare provider, your nurse practitioner, your midwife, those people are there to help give you that information to help you, so you don't feel like you have to decide. You're going to make the decision, but you don't have to investigate all aspects of that. They should be able to put it together in a way that you can digest it, so that you're not overwhelmed. And so that's really what your healthcare team is there for. So hopefully, we get to a space where everybody has access to that, so that somebody can talk to you. And if the doctor can't talk to you, the nurse can talk to you. If the nurse can't talk to you, then your midwife can talk to you. So there should be like a team approach in terms of making sure that you get what it is that you need for your pregnancy. And I can't stress that enough, because for some of my patients, they want to talk about vaccines. Some of my patients will just take vaccines, but they want to talk about some other aspect. So it really just depends on, what it is that you're most concerned about. But do not ever feel burdened that you have so much that you yourself cannot digest it all. That is what your team is there for. So make sure that you're sharing what it is that you're concerned about, what things you want to know, and direct your care. So be empowered to direct your care and get what it is that you need out of your provider. But for me, we talk about everything when it is typically that time to actually have it done. So we will start talking about vaccines peripherally in the beginning, but then when we actually start to hit those particular timeframes of when we would recommend them, then those conversations become way more detailed. But in the beginning, it's just to kind of wet your whistle a little bit that we're going to be having these conversations. So if you have questions that you're going to want to talk about, or if there's family members or your husband or somebody else has had some experience, go ahead and write it down and bring it in. So let's actually talk about it and have a conversation when it gets to the point of us actually moving toward making a decision on execution. But it is a lot. It's a lot in pregnancy. Motherhood is a lot, right? Being a woman is a lot. It is a lot.
Dr. Rogers, I was just going to say, when you were having those reflections on the people who can be trusted leaders in your pregnancy journey, that we had a fantastic town hall last week, and made me think we will send our recordings out probably later today or tomorrow of both last week and this week, which will include the report on building vaccine confidence in the neighborhood that we got to hear about, which is all about finding those trusted providers. So thank you so much for that expertise. Ebony, thank you so much for leading such a fantastic panel. And to all of our really, really remarkable speakers, thank you for providing education for our community today. And for those of you that might be on but are not yet members, I'm going to drop a link, a link and a discount code in the chat if you'd like to become a Mom Congress member to learn about all the amazing things we do in addition to our advocacy for our Mom's Agenda of packaged legislation each year. Our next upcoming event will be on Wednesday, December 6th. We know that the holiday times are a busy time, so we're going to keep it really light after all this great education and offer a member networking session. So Mom Congress members, be on the lookout for an invite to come to your Mom Congress member calendar. We'd love to have you join us. It's just that opportunity to get to know who else is in the community with you before we get excited about the work we're going to do together next year. So again, thank you to all of our panelists and presenters. We're grateful for the opportunity to meet with you all today, and hopefully we'll see you all again soon.
I'll end with saying another thank you to our sponsor for this virtual town hall as well, Pfizer. So thank you to Pfizer for sponsoring this conversation, and thank you again to all of our speakers and registrants who came. See you all.
Thank you.
Thanks, everyone.
Thanks so much.